All right, so as we continue with the facial bones, you have a maxilla. That's the only facial bone with a sinus. You have the palatine, which is your hard palate. So if you put your tongue on the roof of your mouth right now, you'll have that. Actually, here's something interesting you probably didn't know. If you put the tongue on your roof of your mouth and then smile, you get more of a natural smile, and you'll be more photogenic. So next time that you're actually taking a picture, try to put the tongue on the roof of your mouth and smile, or just be like that, and you'll get that nice cut look. Get rid of the double chin look, and it kind of, I don't know, it's just one of those photography tricks that they teach you. Zygomatic, that's the angle of the cheeks. Lacrimal, medial wall of each orbit. Lacrimal, smallest bone of the skull, and then the nasal is your bridge of your nose. And so if you look at, you have two maxillas, two palatines, two zygomatics, two lacrimals, and two nasals. You have an inferior nasal concha here, and then vomer literally means plowshare. There's no muscle attachment. And the mandible, you have one only movable jaw bone in the skull, strongest skull bone. Okay, remember we talked about Kanye West and how he broke the jaw. So when we talk about, you know, the facial features, and we talked a little bit about this early on, but really, according to National Geographic, and when they dig up fossils, there's truly 3 or 4 categories that you can put the human race into. And remember, when you pass away, your skin falls off. So the only thing that's really left are the skeletal features, and based on just the features alone, you have 3 main races. They're coming up with the 4th, and I'll show you that. But you have the Caucasian races, which are the Aryans, the Hamites, and the Semites. You have the Mongolian races, which are Northern Mongolian, Chinese and Indo-Chinese, Japanese and Korean, Tibetan, Malayan, Polynesian, Maori, Micronesia, Eskimo, and American Indian. And if you look at this group here, you can see that their cheekbone structure, their zygomatic process is very similar. Okay. Then you have the Negroid races, which are African, Hatsanots, Melanesian, Papuas, Negritos. Now this is where they want to do a cutoff of the Australian and the Aborigine, and they have a different distinct feature. So let me show you an image of what I mean here. So if you look at this image here, it's very interesting, right? And if you look at the skulls of the Asian female versus the Asian male, European, which would be the Caucasian, and then the African American, right? So these are the, basically when you die, look, there's no brown, white, yellow, olive. There's no skin here. So there's nothing. You're just basing it on cheek structures, zygomatic arches, glabellas, the nasal bone, right? You can't tell what this person had, and you can't judge somebody based on this, right? But that's what we do. But if you look at the inside, it's pretty much all the same, right? I mean, there's some few distinct features of each race, but that's about it. There's no skin color when you die. Okay, so keep that in mind. Now, let's look a little bit deeper into female versus male, though, in a little bit. Now, the notion that humankind can be divided along white, black, and yellow lines reveals the social rather than the scientific origin of race. Okay? So unfortunately, like I said, when they grow up and they all pass away, Caucasian, African American, Asian, they're all going to end up like this. Kind of morbid, but it's one of those things that I want you to realize that, hey, we judge a lot of people based on the skin color, but when deep down, it's just vomer bones and zygomatic arches and temporal processes and maxillas and mandibles and alveolar process, right? But that's not good news. But let's look at males versus females. Now, males and females have distinct features for sure. The male cranial mass is more blocky and massive compared to the females, which are more rounded and tapers at the top. So ladies, you have more of a tapered top. The female supraorbital margin is sharper, while the male's is rather round. So supraorbital margin, so this is round and dull, and you guys have sharper. The zygomatic bone is more pronounced on the male skull. So if you see this, the C, that's more pronounced. The mandible of the female is more rounded while the male's is more squared. Okay, so if you look at rounded and more of a square look in males. Males have a deeper cranial mass, so hence a deeper cranial mass. Doesn't necessarily mean that their brains are larger. Females would say that females are much smarter anyway, but just because you have a deeper cranial mass doesn't mean that your brain is any smarter. And the superciliar arch is large and pronounced in the male here, so superciliar arch. Eyebrows are thicker and more pronounced there. Okay. Again, looking at this in a little bit more zoomed up aspect here. So here's the supraorbital foramen, here's the optic canal, and I made a list of the things that you should know and be able to identify on images. Temporal bone, the zygomatic process of the frontal bone, the greater wing of the sphenoid bone, orbital surface. Okay. Here's the mandible. Okay. Here's the rami, the angle, the body, the alveolar processes. Here's the mandibular condyle. If you have TMJ, then this is what's getting caught. Here's the coronoid process of the mandible. So anything that's in this lecture is fair game for me to ask on the quizzes, on the exams. What are the bones that are associated with the skull? You got the auditory ossicles, bones of the middle ear, the malleus, incus, and stapes. Then you have the hyoid bone, which is a very interesting bone. It does not articulate with any other bone, located between the chin and the larynx. And the fracture, this is interesting, can be used to indicate strangulation. So here's the hyoid bone. So if you find a dead body, again, a little morbid, but if you find this bone that's fractured in, then they were either strangled to death. Now if they hung themselves, the rope will usually go right here and snap this forward, so it will snap outward. So you can tell if a victim was strangled, so if that was homicide, or if it was fractured out, and that would be suicide. Okay, so you guys all remember the Jeffrey Epstein issue, right, where the gentleman was found hanging inside his cell. Well, initial autopsy reports showed that his hyoid bone was actually fractured inward. Only one report came out, and then everything was hushed up. But it's interesting at all. I mean, I'm still sure there's more to the story, but once you know anatomy, then you can start to question, oh, interesting. So what would cause this type of fracture? So if you look at this fracture is outward. So would this be suicide or would this be homicide? So this is an outward fracture. Tell me what you think. So in the case of fractures, the hyoid bone fracture is a very rare fracture of the hyoid bone, accounting for 0.02% of all fractures in humans. It's commonly associated with strangulation and rarely occurs in isolation. The fracture may be associated with gunshot injury, car accidents, or induced vomiting. 50% of strangulations and 20% of hangings, hyoid fractures occur, so you got a 77% chance. So again, outward fractures, hanging, and strangulations would be an inward fracture. So 77% of total strangulation hangings, the hyoid fractures occur. Adaptations, again, I'm not teaching you of what to believe in. This is what science says. If you don't believe in evolution, that's perfectly fine. But bipedal locomotion is possible because of these evolutionary adaptations that occurred. Changes to the feet, legs, and vertebral column, changes to the skull, the foramen magnum move to inferior position, and the face is flatter with less weight anteriorly. So those are direct effects of transitioning from quadruped to bipedal. So if you were here, right, chimpanzees, and humans. A lot of times people say that humans evolved from apes. That's not true. You guys need to take a anthropology, sociology class, and even a biology class. There's no way that humans can evolve from apes, otherwise apes would no longer exist. So what we had was a common ancestor, and then based on that, the humans evolved from that, and then the chimps evolved their own way. So you can't use the right terminology by saying that humans evolved from chimps. Okay, so don't do that. You want to make sure you understand evolution and how it works. Now, let's take a look at the vertebral column. It's a chain of 33 vertebrae and vertebral discs. You have 7 cervical, 12 thoracic, 5 lumbar. Here's the sacrum, but it's fused 5, and coccygeal, which is another fused 4. What does the vertebral column do? It functions, supports skull and trunk, allows for movement, protects the spinal cord, absorbs stress from walking, running, and lifting, provides attachment for limbs, thoracic cage, and postural muscles. Here it is. How do I remember? I eat breakfast at 7, lunch at 12, and dinner at 5. So 7 cervical, 12 thoracic, and 5 lumbar. You have normal curvatures that occur at birth. Column is C-shaped. Primary curvatures are thoracic and pelvic curvatures. By age 3, the column is S-shaped with cervical, thoracic, lumbar, and pelvic curvatures. Here's our secondary curvatures, cervical and lumbar curvatures that develop after crawling and walking. So remember, your primary curvature is your upper back, thoracic, and your pelvis. That's why you like the fetal position when you're trying to protect yourself or need comfort. Those are your primary curves that we develop. So that's why you revert back to those primary. You're hardwired to go there. Remember how we talked about why humans crave sugar and fat, because you're hardwired from the beginning that sugar and fat is comforting. So cervical, thoracic, lumbar, pelvic kyphosis. So some of you might have heard of this, scoliosis. Now you have hyperkyphosis, right? This is the dowager's abnormal posterior curvature. And then you have hyperlordosis, which is a sway back during pregnancy or someone that's extremely overweight. Here's some more abnormal curvatures, right? So here's an x-ray of scoliosis. Look at this, that's extreme kyphosis, and again, that's extreme lordosis. If you look at the general structure of the vertebrae, you have a body. You have a vertebral foramen, which the spinal cord goes through, vertebral arches. So if you have osteoporosis, you can actually fracture this. You can get a compression fracture as well. Okay, spinous processes are those bumps that you feel in your spine, right? That's where the chiropractor or the PT will push on. So IV disc, you guys have heard of lumbar problems, I'm sure, right? Lumbar disc issues, disc herniations, nucleus pulposus. That's the disc between the vertebrae, which usually dries out and causes you to shrink. It's mostly water, but if this gets ruptured, then it can push on the sciatic nerve. So here's the disc in between the vertebrae. And again, you're taller in the morning because these fill up with water. And then throughout the day with all the compressive forces, sitting, the walking, the athletics, it'll just seep out of there. Now, let's start with the cervical, and you have C1, which is your atlas, and C2. So 7 total, smallest and lightest, bifid process for the nuchal ligament. So C1 allows you to do the little yes motion. It's flat, there's no body, but it basically supports the skull. And the reason it's called Atlas, you remember from Greek mythology, the gentleman that has the world on his shoulders, his name was Atlas in Greek mythology. So C1 is named for that, holds your skull. C2, that's the no motion. Not that there's no motion, but it does the no motion. DENS provides rotational movement. So here's C1, sits on top of C2 and provides that rotary component here. So if you look at this, that's C1, that's C2, And then the Indian head nod. Oh, don't know. Am I doing C1, C2, C3? I don't know. I do a little dance here. Okay. All right. So now you can't do that accent behind my back. So it's only allowed for the professor. Okay. Now, here's the thoracic vertebrae. 12 total costal facets. Since you have 12 pairs, that means you have a total of 24 ribs. Spinous process pointed and angled downward, larger than cervical. So his cervical are the smallest, then the medium size are thoracic, and then lumbar are the thickest and the largest. And you have 5 of those thick because they're mostly weight bearing, right? So again, here's the cervical, here's the thoracic, and here's the lumbar. Then you have the sacrum, 5 vertebrae that fuse together. Okay. Fusion begins by age 16 and finishes by age 26. So as a child, these are 5 separate bones here. So that's why if they fall on their butt, it's not as bad, or they fall on their tailbone. But as an adult, if you fall, you can actually fracture your coccyx, and that's one of the most painful things out there. So you got to be careful. Again, that's your colloquially the tailbone. So provides attachment point for muscles of the pelvic floor. So if you have issues with the pelvic floor, urinary incontinence, we can look at the coccyx and see if there's any issues there. Thoracic cage, again, you have 1 sternum and you have 12 pairs of ribs, so a total of 24. Ribs 1 through 7 are true ribs. That means they have a true attachment to the sternum. Ribs 8, 9, and 10, they share a common attachment, and then 11 and 12 are floating. Unfortunately, a lot of people, some females like to remove their 11th and 12th rib to get a more hourglass figure. I think Janet Jackson had one of her ribs removed. Now the ribs are made for a reason, right? So they're there to protect the kidneys, the liver, the stomach. So don't go around removing bones. It just isn't ideal. See? But you can't help stupid. Some people are just dumb. So she removed 11th and 12th rib, and then she started wearing a corset to get that, right? And then, you know, the dumbest of the Kardashians, well, they're all dumb, but then Kim started this corset training, and then Khloe jumped on the bandwagon. You can't spot reduce. So no matter if you wear this corset or not, but what she's trying to do is train her ribs to come in. Kids follow her, and they tried this, and a few of them actually fractured their ribs and ruptured their spleen. So you gotta be careful when you follow these dumb people on Instagram. They really aren't medical experts, but they'll try anything, the latest and greatest, and the females will start to copy this. So don't do this, because remember, if you squeeze here, your organs have to go up and down, so you're squeezing these organs. That's not good. All right, the sternum, the manubrium, broad superior portion resembling necktie, suprasternal notch, clavicular notches. Xiphoid process, that's the inferior end. So if you do CPR, sometimes you can break this off. Again, 12 pairs, true ribs 1 through 7, each has its own cartilage to the sternum. The false ribs are ribs 8 through 12, lack independent connection to the sternum. Ribs 8, 9, and 10 attach via rib 7, and ribs 11 and 12 are the floating ones. These are the ones that sometimes females have removed, such as Janet Jackson. The anatomy of the rib, you have the head, the neck, the tubercle, and the shaft. Okay. Then you have the angle of the ribs. Here's the articulation of how this rib attaches to your thoracic. So the head of the neck articulate with the facets of the thoracic. Here's what an intervertebral disc, right? So you can see how these discs can sometimes rupture and then push on the nerves in the back. So here are the nerves that exit. And you have these going up and down your entire spine. Cervical vertebrae, again, review, are the smallest, C1 and C2. Here's what an MRI of a disc herniation. See what a disc herniation is. So see how it's seeping through and then pushing on the spinal cord. Not good. Okay, this causes numbness, tingling, weakness, falling. And Here are the pathologies. Skull fractures, cranial fractures may damage brain, nerves, and meningeal blood vessels. So if you get hit by a baseball bat, Le Fort fractures of the facial bones, vertebral fractures and dislocations may damage spinal cord, and then herniated discs. So here's some different types of fractures. Here's a Jefferson fracture, which is a burst fracture if you fall right on your head. Okay, that's what it would look like right here. If you fall kind of on your head, but then you twist, you can get a lateral mass fracture. If you fall and then you kind of bend your neck, then you can get an anterior arch fracture. These are all bad news. And then if you fall and your head goes back, this is probably the most severe. A lot of times this can end in death. Posterior arch fractures. Okay, so you got to be careful with these. Development of the axial skeleton, primary endochondral ossification. Remember, you have intramembranous or endochondral ossification. So your axial skeleton was mostly hyaline, and then it becomes ossified and becomes bones. And the reason we like it to be hyaline, so it goes right through the birth canal. Skull development, neocranium, visocranium. Babies have what we call soft spots or fontanelles. Okay, fibrous membranes and gaps between cranial bones. Anterior, posterior, sphenoid, and most of those fontanelles or those soft spots close by the age of 24 or 2 months. That's why I keep emphasizing the first 2 years of life are so important. Please take care of your kids. And the mandible, did you know that 2 bones at birth, they fuse at midline to form 1 bone by 3 years of age in babies? So here's a little critter here, and these are the little soft spots, right? Here's the anterior fontanelle, then you have sphenoidal, and then you have a mastoidal fontanelle. And so these eventually will all close, but these are there so that the baby can fit through the birth canal and shape. But if you keep your baby on its head, like sleep on its back, then this can get kind of deformed, and you'll see babies with the helmets. All right. So here's what those helmets look like, right? So they'll help, because it's hyaline cartilage, it'll help shape the bone, and they have to go in every few weeks. So depending on, see, his is cut differently than his, depending on where the deformity was. But and you can only do this before the age of 2, otherwise it becomes permanent. So that's why you'll see a lot of babies before 2 get this done. Okay. Again, so there's the newborn skull. Vertebral column development, the notochord. Vertebral bodies arise from sclerotomes and mesenchyme, which are stem cells. And ossification begins before birth, but it doesn't fully end until the age of 25. The ribs, they start chondrification by week 6. Week 7, endochondral ossification. So this is, again, just showing you how important it is the first trimester, because everything starts to form and you have a basic structure within the first few weeks. All right. Take care of your body, take care of your kids, eat right, and exercise.